I am Dr. Avinash. I am a consultant pulmonologist at Apollo BGS Hospital, Mysore. This video is being done to commemorate World COPD Day, which is supposed to be held on 21st of November 2018. This year's theme is Never Too Early, Never Too Late. It is always the right time to address airway disease. Just emphasizing the fact that early detection of airway disease leads to better interventions, which can lead to a longer and more happier life. On this note, what is COPD? Chronic obstructive pulmonary disease is a common, preventable and treatable disease which is characterized by persistent airway symptoms in the form of chronic cough and breathlessness secondary to damage to the airways and the lung parenchyma. What are the causes of COPD? Smoking is the commonest cause of COPD. It can be either in the form of active smoking where the person smokes or in the form of passive smoking resulting in environmental tobacco smoke exposure. Second most common cause of COPD is biomass fuel exposure among rural population, especially women. And third is pollution. How does COPD present? COPD presents usually in the form of symptoms like cough, sometimes which is dry, irritating, which has the name called as smoker's cough itself. Usually, cough is productive, which leads to whitish colored sputum, which can later turn into yellowish, greenish colored sputum. Or second, in the form of breathlessness, which usually occurs during exertion or exercise, and in a progressive disease can occur even at rest. So how to detect COPD? COPD detection has three important parameters. One is awareness among the individual about the symptoms of the disease, because usually what happens is smokers attribute their symptoms to smoking but not to the disease. Second is they should know when to come to a doctor. When they come to a doctor, our diagnosis or suspicion is based on their history and physical examination. Confirmation of their diagnosis requires a pulmonary function test where the person is asked to blow through a narrow tube which is connected to a computer for better assessment of his lung functions. In very severe COPD, in whom oxygen concentration in the blood is on the lower side, we would require an arterial blood gas analysis and also a echocardiogram in order to assess the heart related issues. How do you manage COPD? COPD management requires early detection, as I already emphasized before. Second is pharmacotherapy. Pharmacotherapy is in the form of inhalational agents, either in the form of metered dose inhalers, dry powder inhalers or nebulization, along with mucolytic agents and oral bronchodilators. Pulmonary rehabilitation, it is a new field that is coming up where we assist a person in order to lead a full life by addressing their physical, mental, emotional well-being and help them to lead a long and a better life. COPD squeezes the life out of you, so early detection and early intervention is always better to lead a long and better life.